When you're looking to do an orthopedic trauma fellowship, you know you want to get the training that you can go out there and be prepared for anything. There's not really any part that we have that's not covered in depth with case examples, with volume, with experience in this place.
The faculty commitment to excellence in education is unsurpassed. The current fellows really get a variety of ways to treat these injuries.
Being a fellow here was an outstanding experience. It was a clear decision for me at the time to come here as the best program in the country because of all the teaching that was here, the faculty that were here, as well as the case volume and complexity, and then have the opportunity to stay on staff. There's no other place I'd want to work other than here.
I came back because of how awesome all the faculty are here, and that I wanted to be a part of something that was bigger than myself and that gave so much to me. They all taught me so much and what I know how to do in orthopedic trauma, that I wanted to come back and be a part of that department.
One unique aspect of our practice here in Houston, Texas is just the overall size of the metropolitan area. So because of that, we're the busiest trauma center in the United States.
We give quite a bit of freedom to our fellows during the case either, but your attending is operating with you or in the room next door coming back and forth. So you're not used just to fill the call schedule. You are actually here to be educated.
Our team of PAs and nurse practitioners work primarily in the preoperative and postoperative phase of the patient care. That way, the fellow and the resident are able to be in the operating room one-on-one with their faculty and get the most out of the learning experience.
Everybody knows this place for their volume. For the fellows, pretty much you'll see it all here. The dedication to education amongst the attendings, we were really learning from experts in the field. Being able to learn from their experience makes me feel ready and prepared. The attendings expect us to have pre-op planned for the cases, have a plan going in, discuss it, and then depending on the plan, they allow us to go in and execute it.
Experiences drive relationships, and those relationships go to the students that they're working with, the residents that they're working with that are lifelong, and then their co-fellows, and then the relationships that they develop with the faculty and the staff as well.
We have faculty members that have tentacles throughout the country. And because of that, I think when it comes to jobs, when it comes to developing your career moving forward, I think it really is the best place for that.
I think the group here is incredibly unique. I think each one of us is incredibly hardworking. We love to have fun at work, and we are always striving to provide the best patient care. I think the fellows and residents that rotate through our service feel that, and they feed from that and have no choice but to engage with us to help provide a high level of quality patient care.
One of the most important parts about fellowship is getting you prepared for the next stage of your career. So we have a track record of helping fellows get to exactly where they want to be at busy level 1 academic trauma centers.
You have volume, you have excellent clinical cases, you have resource and support from the university, from the department head up. You have a group of individuals who all work as a team, who are all extremely knowledgeable, thoughtful, excellent innovative surgeons, and more importantly, superb educators.
If you want to take care of high energy blunt trauma, there's no place better probably in the world. It's not just you come here for a year and you're gone and we forget about you, but you're part of a family and we care about your career through and through.